The Bambino Gesù Hospital of Rome is the coordinator of the MD Pedigree project. The goal of our institution is to provide a better health care to obese adolescents that is based on a true personalized approach and also to target the hidden morbidity associated with obesity. Obesity is a complex phenotype and results in tools developed within the MD Pedigree project, I'm sure, will allow to recognize that each patient has a unique person and to treat him accordingly.
How do we tackle the big health problems of the 21st century? Great strides have been made with traditional approaches in medicine for the diagnosis and treatment of diseases like cardiovascular disease and obesity, but prevention and personalized medicine are now the key health agendas that we must face. We need to understand the early processes of disease much better than we do now if we are to overcome the problems of obesity and cardiovascular disease. How can we do this? There are 1.4 billion overweight or obese people in the world. 44% of them will have diabetes at some stage in their life. Nearly a quarter will develop ischemic heart disease. Up to 40% will develop cancer. This is not a small problem. To prevent this, we need very detailed studies of the disease processes linked to obesity in the earliest phases of life. In other words, we need to study children. This is what primordial prevention means. This is what the American Heart Association have called for, a way of getting at the earliest processes and tackling them before people develop problems that we can no longer really fix. And it will only be achieved by deep phenotyping of those early disease processes. This kind of study generates significant amounts of data and needs new ways of understanding the knowledge that that data can generate. That, in other words, is a big data challenge, and that is what MD Pedigree is all about. Taking a wealth of carefully measured data on early disease and using powerful computational techniques to find the important processes that determine what is going on and how people are becoming unwell so that we can tackle it before they do. They will not be the same processes in everybody. So here, MD Pedigree will allow us to tailor our medical interventions to be most effective for each individual patient. At UCL, we are developing cutting-edge MRI techniques for understanding the physiology of obesity in childhood. We're using methods we've developed to cope with the difficulties of imaging young children. They move around a lot, they don't stay still for long, they won't do your breath holding. We need fast, clever ways of getting the information while they're doing those things. By using those techniques, developing those techniques to be robust to that kind of patient, we've also developed a technology that allows us to look at changing physiology. The speed of those methods means that we can use them for studying the dynamic processes involved in the physiology of obesity. To get a better understanding of obesity in young people, we look at how their cardiovascular, endocrine, metabolic, and inflammatory systems act in concert to cope with a high-fat, high-sugar meal. We think that studying physiology as it changes in response to a challenge is more revealing of early disease than studying resting measures alone. As with many elements of this project, this generates very rich data, and this will be a big challenge for the people working on the computational aspects of the project to understand how to extract the best meaning and develop the most revealing models of early disease using that rich data. We think that those rich models will be much more useful and much more interesting in the future for understanding the disease of obesity.
In MD Pedigree, Fraunhofer quantifies fat of various anatomical structures using special MRI data provided by our clinical partners. This data is then used to analyze how various fat distributions contribute to cardiovascular diseases. To achieve this, Fraunhofer researches the latest model-based segmentation technologies and integrates them into an easy-to-use software application.
In MD Pedigree, our role is to address the big data challenge of building predictive models for assessing the cardiovascular risk of obese child patients. And the two tasks we have is first to create virtual phenotypes for our patients and develop predictive tools based on case-based reasoning. So what does it mean? First, we need to create a multi-modal representation of obese child patients. We used imaging data to extract phenotypes. For instance, based on cine MRI, we extract data that characterize the cardiac function. And Siemens is working on that, but also INRIA. And on the side of Fraunhofer, they extract information on the distribution of adipose tissues. Then we have all these different sources of information, not only imaging phenotypes, but also clinical information, maybe blood tests. And we need to find a meaningful way of using all this information into a good and compact representation. Clearly, there are some challenges that are coming from a different nature and dimensionality of this data. And we tackle at Siemens this challenge by using state-of-the-art machine learning technique. On the second task, what we need to do is to build a predictive tool based on case reasoning. Here, we develop a tool what we call case reasoner. And you can imagine if we are given a huge data set of patients that are associated with a clinical outcome, and we have a new incoming patient, what we do is we search within this huge data set the most similar patients, and we are able then to perform inference based on the clinical outcome they have. Our vision for this tool would be to have a web application for clinical research on one aspect, to allow our clinical partners to explore patient cohorts, to understand correlation between clinical factors, to stratify patients, and even to build predictive models themselves. And maybe the outlook in the future would be to exploit these built predictive models or the discovered information in the clinical routine for therapy selection, to support diagnosis, or also to predict some clinical outcome.